Good morning, everybody. I'm assuming everyone can hear me. I'm so happy to talk about this today on behalf of TransLink. What I'm going to speak about is really how health impacts can inform longer-term transport policy. So more specifically, what are the linkages between health and transport, the role of health in our creating our longer-term policy. Then I'll look at a higher level of a case study that we did, quantifying the health impacts in preparing our long-term transportation strategy, which is our strategic framework that was adopted in 2013. And end with a discussion about partnerships and really the role of health in a recent referendum that you may or may not have heard about that we experienced here in BC. So the link between transport decisions and health outcomes is well established, as Danielle mentioned. I know Louis is going to go into a lot of detail in terms of the evidence behind that. But what this graphic tries to show is that many different health areas can be linked back to individual decisions on how we travel, whether taking transit, walking, driving, cycling, etc. So the health impacts can be characterized in two ways, either resulting from transport behaviors, for example, physical activity, or not, in my case anyways, and transport exposure, for example, noise, vehicle emissions, etc. For example, the way land use decisions are made can impact the amount of driving that is done. And this, as a planner, working primarily on the land use side for the last 20 years, and this is evident in some of the neighborhoods and cities that I worked in. So this in turn can impact the volume of traffic, the speed of vehicles, which then really has a direct impact on road safety, individual stress, etc. Likewise, when communities are designed to accommodate walking, cycling, transit, this increases the level of physical activity, which has a host of positive health benefits, including things like chronic disease rates and improved mental health. So these are simplified examples, but the research undertaken points to a strong relationship between these factors. In BC, healthcare costs constitute about 41% of the annual provincial budget, much of which is associated with chronic disease that can be mitigated by making different transportation choices. So because the link, we feel the link is so clear and so important, we at TransLink commissioned research from UBC's School of Population and Public Health to help us understand the nature of these relationships. When we began the long-term preparation of the long-term strategy, we knew that this would be one of the defining themes in our long-term plan. And if you're interested, the research is available on our website, aggregates all the key research that makes connections between these decisions and health outcomes. So just on the translink.ca website. And if you need, I can make that available to you. So before I show you how we integrated the research into the policy preparation, it's worthwhile thinking about why these two disciplines are working more together. So one of the things we think is it's really the rising city agenda. Urban populations are growing, and urban decision makers are understanding that this is a significant impact. Both of our disciplines are trying to reconnect with the past. So the history of planning is strongly linked to addressing major public health concerns. For example, the building of new housing in the 19th and 20th centuries to overcome disease from slums in those days. Financing, I'm not sure about you, but for us, financing is a challenge. And I mentioned the increase in health expenditures. And so we're finding the need to partner to be more creative. The growth of joined-up government, increasing reference with government to how different departments have to work together to create synergies. Data collection is advancing, and it's easier to make the linkage now than it was before. And lastly, just looking at demographic trends, chronic health conditions, and changing mobility patterns. So how have we tried to attempt to reflect the important role of health in the way we operate and make our decisions? So firstly, we included a health goal in our 30-year long-term strategy, which also is available on our website. At TransLink, we appreciate that transport is not the end goal itself. It's a means of achieving other things, much like I'm sure yourself. In Metro, we place a strong emphasis on the quality of life, and therefore one of TransLink's goals is to foster safe, healthy, and complete communities. So these are communities that are connected and compact. And this demonstrates the importance of public health as a key goal. So following the higher level goal, we recognize that we needed to operationalize the health lens. So one way of doing this was to model health outcomes when deciding how to invest in new transportation investments. So we have an operating expenditure of roughly $1.5 billion. So the criteria for investing can make a significant difference on where we put our dollars. And how we start to think about moving our needle in terms of moving towards the implementation of policies towards the end goal desired. So some of you may be aware, we've been moving towards performance-based decision-making, looking at multi-criteria assessments more than just cost-benefit analysis when deciding how to invest our scarce dollars. So the planning group therefore developed a strategic health impact assessment to help quantify the impact of transport on health outcomes. So the stated aim, as identified in the slide, was to understand how the proposed regional transportation strategy investment and policy packages perform with respect to impacts on public health outcomes. With this said, though, it was recognized this was a first attempt at applying a health impact assessment to a policy or plan. Typically, these types of assessments are applied to a project, and more specifically, not a broader neighborhood or region. So this was really a learning exercise for us as an agency and as well as our health partners. The Strategic Health Impact Assessment was a joint effort undertaken between us, TransLink, and two health agencies in our region, which are Fraser Health and the Vancouver Coastal Health. So the first step was working with health experts to understand key objectives such as increasing physical activity or reducing traffic injuries. The second step was linking this health objective to the related transport objective and finding a metric to best capture the impact. This would then allow us to quantify the health benefits of different investment scenarios. Let me go back one more. So this is just a snapshot of the type of analysis that we're able to undertake. Shows how we could quantify health impacts of long-term investments. And these alternatives in this case, base case alternatives 1 through 3, are looking at different investment packages. For example, the base case was just status quo, no investment. Alternative 1 was bus-only expansion. Alternative 2 was a higher intensity transit expansion, but unlike alternative 3, didn't involve the rapid transit as well as TDM measures, which we found significantly impact the results. All of these shared similar pedestrian, cycling, and network and road connections. So some of the key findings of the health impact assessment were essentially we found the transport data not consistent, given the fact that we collected for different reasons. And there was a tension between the aggregate regional numbers versus the individual numbers that we were finding. Health often works at the individual level, whereas we, in a regional transportation context, look at the larger neighborhood level and city level. The alternatives with greater VKT reduction led to better health outcomes. I know that sounds obvious, but the magnitude of the change was important to note in these cases. The SHIA also took greater account for land use changes, and this was a challenge with the tools and models that we had at our disposal. Equity was seen to be both a separate objective and a lens for other objectives. And lastly, working at the regional level can't always account for site-specific design variations. So almost wrapping this up, so this slide talks about the plebiscite that we were involved in this past summer, last summer, seems like a long time ago. The work we undertook as part of the strategic health impact assessment was really important from a technical perspective in preparing this, the documentation for the plebiscite. But it was also very important for building partnerships with the health sector, who were vocal advocates during the recent referendum. In fact, the chief medical health officer stated that the vote that people were making wasn't a vote on public health. It was a vote on public health and not on transport. In other words, he flipped the discussion of the whole context of whether or not we should be investing in transportation, but rather voting on health. So you probably heard that we were not successful in terms of the referendum outcome, but what it did highlight was how important the partnership is with the health community, and also the fact that they see this as a key tool in their own toolbox for improving health outcomes. So moving forward, we're going to continue to work with our health partners for a combination of research, policy development, and partnerships during key times of decision making. I think I'll just end with this last slide that's from the health impact assessment. And what it shows essentially is that the way we build our cities impacts how we travel, which then directly impacts the health of our citizens and the costs associated with these. And I think we can underscore the old saying that a good transportation plan is a good land use plan, because it really does impact the way people move and live in these communities.